Well, to talk about pharmacare, we're now joined by Pauline Worsfold. She chairs the Canadian Health Coalition, a group that's been on the Hill this week lobbying for public health care. Pauline, good to see you again. Welcome back to the program.
Thank you for having me.
So obviously pharmacare is the big issue right now as we approach this March 1st deadline. And we know that the NDP, the party, its membership, they want a public single-payer system to come out of this pharmacare scheme. You support that. Why? Why in particular, as the government is already struggling with a deficit and a debt in the red?
Well, the reason that the Canadian Health Coalition and many others support a single-payer universal pharmacare program is that we need to make sure that there is no profit involved, first of all, that, and second of all, that it's universal so that everybody can access it. All people living and working in this great country of ours are suffering. They're suffering because they have to choose between putting food on their table and buying their prescription medications. I'm a registered nurse. I've been a registered nurse for 43 years. And let me tell you, the healthcare workers out there, they have stories. Stories of people cutting their medications in half to make them last longer. And then, of course, what happens? A few weeks later, when the medication is not doing its job because you're only getting half, they end up in the emergency department. So a national public drug plan that's universal and single payer would actually help with the healthcare crisis that we're in now by decreasing the number of people who access the emergency departments for healthcare.
Mm-hmm. Earlier intervention versus later intervention, except that, you know, when you look at what the government has done with dental care, and in fact, Ottawa is also supporting a pilot project in PEI right now, which has to do with pharmacare. And if you look at those two programs, there is built in there this economic bar that has to be met, this means test as to whether or not you qualify for the programming. And really, it doesn't cover everything, but it covers a lot for many. Would that not be acceptable if what we're talking about is covering the needs of the majority rather than making sure everybody had something for free?
The means testing is a bit of a burr for us insofar as what does it matter what you make? Like, if you have coverage or don't have coverage, if you do make a lot of money, if you don't make a lot of money, you are entitled to medications that are going to keep you healthy. So the means testing is just not on as far as our vision for a national public drug plan, a pharmacare plan.
Are you at all worried about the finances here? We've already seen estimates that would basically be about $11 billion plus a year in order to fund a publicly delivered system when it comes to pharmacare.
I'm not worried because that is in the setup and the administration and to get it up and running. You know, there's always upfront investment costs for any public program. And overall, the savings that would be reached on the back end outweighs the investment by billions of dollars.
Mm-hmm. Now, you know, I do wonder, though, because if, for example, we stick on pharmacare alone, we know that many Canadians already, through their private employers, have a private insurance system that helps fund the majority of the cost when it comes to drugs. Why not allow that system to continue and still have a public system that covers those that do not have private insurance? Why can't those two coexist together?
Well, the Quebec model is exactly what you described, and as what we know from our colleagues in Quebec, it is just not working. It's not working. It doesn't give everybody a chance to access the medications that they require for, you know, health and to de-stress, and those essential medications that are prescribed need to be covered 100% universal single payer. End of story.
So you say that people are falling through the cracks, or that their copay is too expensive?
Both. And thank you for bringing that up. They are falling through the cracks, and yes, the copay is too much.
Now, as you make this argument for pharmacare, and again, we're watching this very closely as the two parties, the governing Liberals and the NDP, continue to move towards their March 1st deadline, you're also here making the argument for public health care writ large. And to that, we know that the federal government did convene a First Minister's meeting a year ago. Subsequently, they've been negotiating these bilateral deals with the different jurisdictions. Just this past week, Ontario, British Columbia, Northwest Territories. You know, Ottawa has essentially opened up its wallet to help address issues like wait times on primary care. What more do you actually want to see out of these deals, acknowledging the fact that at the end of the day, healthcare delivery is a provincial jurisdiction, not federal?
So these deals are good. I give the federal government credit for being creative as to giving additional funds, because as I said earlier, the healthcare system is being held by duct tape and goodwill of the workers. And so we need help. I'm a registered nurse, I said already, and I still work at the bedside, so I see what's going on. Now, as far as the money that's being transferred, that money has to have accountability mechanisms attached, because we don't want governments getting the money and then putting it into private for-profit healthcare delivery. We need it to go into public healthcare delivered by public servants, by healthcare professionals in each of those provinces and territories that you mentioned already. So we can't have the transfer go from the federal government to the provincial government and for them to either squirrel it away for a rainy day or to create for-profit surgical clinics, which we know is a drain on the public health system for resources, workers, healthcare professionals. We can't have a dual system in any province or any of the territories.
Pauline Worsfold, I always appreciate the time. Thank you once again.
Always a pleasure. Thank you.